our whole country will support delivery to support our constituents wherever in the United Kingdom they might look.
Well, quite right. The NHS is one of Britain's proudest achievements, and it operates across the whole of Great Britain, and cooperation is ingrained in the DNA of the NHS, and I am absolutely determined, as the UK Secretary of State for Health and Social Care, to make sure that wherever you live in this United Kingdom, you can access the very best of care. So if a constituent of my honourable friends in Aberdeenshire needs a treatment that is only available in England because it's so specialised, then they should have absolutely every right to that treatment, in the same way that a constituent of mine in Suffolk, or indeed of my honourable friends in North Wales. We have one NHS across these islands, and it's one of the things this country is most proud of.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Philippa.
Thank you, Mr. Speaker. I'm sure the Secretary of State is well aware that the Scottish NHS has been separate since 1948 and has been under direct Scottish Government control for the last 20 years. So there's actually 4 NHSs. Perhaps I can ask the Secretary of State about some of his decisions that have made it harder for the Scottish and other devolved governments to fight COVID. Last September, he refused to follow sage advice for an urgent lockdown, and the 6-week delay allowed the more infectious B117 Kent variant to emerge and spread across the UK, driving a second wave more deadly than the first. He has repeatedly claimed to follow the science. So can he explain why he didn't follow scientific advice last September?
Secretary of State.
Thank you very much, Mr. Speaker. Just on this point, this attempt at division within the NHS is deeply regrettable. Deeply regrettable. It's not what people want. It's not what people want in Scotland. It's not what people want anywhere across this country. The NHS is an institution we should all be very proud of. Of course, it is managed locally. It's managed locally across parts of England. It's managed under the devolution settlement in Wales and Scotland, and health services in Northern Ireland, rightly so. But it ill behoves politicians to try to divide the NHS. It is a wonderful institution that should make us all proud to be British. On the specific second question she asked, of course, we are guided by the science and take all factors into consideration. These are difficult judgments based on uncertain data, and we make the best judgments that we can, and that is still the process that we're going through, in the same way that the SNP government in Scotland has recently opened up parts of the rules in terms of social distancing in Scotland. Despite the rising cases, we face a challenging decision ahead of the 21st of June, but that decision is made easier, and indeed the decision to open up is only possible because of the UK vaccination effort. And today marks 6 months to the day since Margaret Keenan was the first person in the world to receive a clinically validated vaccine in Coventry, the same day as Scotland, same day as Wales, and since then we've delivered 60...
Order. It's not a statement, it's an answer we require. Second question, Dr. Philippa Whitford. Philippa.
I think the Secretary of State would find that most people in Scotland were rather glad that their NHS did not come under the Health and Social Care Act fragmentation of 2012. But having ignored the Scottish Government's call in February to undergo hotel quarantine, he then delayed adding India to the red list. This allowed the more infectious Delta variant, which one dose of the vaccine is less effective against, to enter and become dominant in the UK. Is he not concerned that if he removes all social distancing completely in the near future, this variant will cause a COVID surge among those who are not fully vaccinated?
Secretary of State.
As I was saying, Mr. Speaker...
Maybe not.
Touché, sir. Touché. In response to the question put by the honourable lady, what I'd say is this. The opening up and the return of our freedoms is only possible because of the UK vaccination effort. And in the 6 months to the day since we first vaccinated across these islands, yes, in Coventry, but also in Scotland, in Wales, in Northern Ireland, starting 6 months ago today. Since then, we've delivered 68 million vaccines across the whole UK. We've saved thousands of lives, and the whole of the United Kingdom has been set fair on the road to recovery thanks to the UK government's vaccination effort. I'm very grateful to everybody in Scotland, in Wales, in Northern Ireland and in England who's played their part in delivering it, and that shows the benefit of the United Kingdom Union saving lives, working together for everybody on these islands.
Substantive question to the Minister.
With your permission, Mr. Speaker, I will take questions 4, 5, 6, 7, 8, 9 and 10 together. I am hugely ambitious about social care reform. I want a sustainable care system that meets people's needs and aspirations and gives them the care and support they need to live life to the full. We are working on proposals for reform and will bring these forwards later this year.
Go to Carl Turner. Carl.
Thank you, Mr. Speaker. This government is responsible for over 40,000 needless deaths from COVID-19 in care homes, and a plan to fix social care in this country is long overdue. But this crisis isn't new. People are routinely forced to sell the family home to pay for care. The workers are paid peanuts, while over 13 million unpaid carers are left to pick up the pieces. So does the Minister agree that we have had far too many vague promises and that unpaid carers cannot wait a minute longer?
Minister.
Thank you, Mr. Speaker. Well, I agree with the honourable member that there are many challenges indeed for social care, and that is one reason why, in fact, many governments have talked about social care reform. As he will understand, over the last year we have rightly focused on supporting social care through the pandemic, but we are working on our proposals for reform. We'll be bringing these forward later this year.
Let's go to Christine Jardine. Christine.
Thank you very much, Mr. Speaker. Almost 2 years ago, the government promised to fix social care once and for all. But we've seen in this pandemic that it is still seriously broken. Care doesn't stop at the hospital exit or the GP's door. Carers have sacrificed physical and mental health caring for loved ones during the pandemic. 72% have had no break and 44% say they're at breaking point. So in this National Carers Week, can the Minister commit to cross-party talks in the immediate term to fix the social care crisis throughout the UK?
Well, this week, as she says, is Carers Week, and it's a really good opportunity to raise awareness about carers, the important role that carers play supporting loved ones, and also to remember something that I personally am committed to is not only that we must support carers in the care that they do, but also to live their own lives, for which, for instance, respite care is really, really important. And as part of our reform for social care, we are, of course, listening to carers and want to make sure their needs are met as part of these reforms.
Thank you, Mr. Speaker. In July 2019, the Prime Minister stood on the steps of Downing Street and pledged to fix the broken social care system. 2 years on and we're still waiting. Wise words were only mentioned in the Queen's speech a couple of weeks ago to say proposals on social care reform will be brought forward. So can the Minister explain when you will move from the rhetoric to more words and bring reality to fix this broken system for the people that you've just mentioned that need it desperately?
Well, I welcome her support and interest and that of others across this House for social care reform. As she said, we know that social care reform is needed. We have rightly, over the last year, focused on supporting social care through the pandemic, getting £1.8 billion of extra funding for social care to the front line, providing billions of items of PPE, over 100 million tests to social care, and the vaccination programme, of course, to care home residents, those who receive social care, and the workforce. And we are working on our social care reforms, and we will bring those forward later this year.
Dougan.
Thank you, Mr Speaker. Many in this place and across England will be asking, where is England's long-awaited social care bill? Because they'll see in Scotland that the SNP government are delivering a new deal for the social care sector, building a new national care service that will improve worker conditions and standards of care, and increasing investment in care by 25%. So will the UK government follow Scotland's lead in transforming social care, and will the Minister contact Scottish Government ministers to learn from our experience of over a decade of integrating health and social care?
Well, one of the great strengths of our United Kingdom is to be able to work together and to learn from different parts of the UK, and also, in fact, to look at the best within. We look at the best within England, we look at Wales and Scotland, Northern Ireland, of course. He also mentions the care workforce, and that's something I want to touch on, because as part of our social care reform plans, we absolutely want to make sure that the workforce is front and centre of those and receives the training, the opportunities, the recognition and the reward that that important workforce deserves.
8 withdrawn. We go to Mike Ainsbury.
Thank you, Mr Speaker. The government have had 11 years to reform social care. Cuts £8 billion out over that period of time. It's fragmented, it's costly, it doesn't value workers and employees. Isn't it time that the Minister and the government grab the bull by the horns and introduce a national health and social care service? When a reform's going to come into play? What day? What month? What year?
Well, actually, it's not just the period that he mentions that social care reforms have been talked about. It goes back at least 25 years when Tony Blair was leader and Prime Minister, and he talked about reforms to social care. But he's also said it's not simple. These are complex problems to address. When people talk about social care needs fixing, different people mean different things. That's why, as part of our reforms, we're going to bring forward a long-term plan for reforming social care.
Dame Diana Johnson.
Can I just say to the Minister that I think most members of the House of Commons will find her attitude incredibly complacent on one of the key issues that face most families in this country. Now, as my honourable friend has just said, there's been an £8 billion cut to social care since 2010. One of the steps she could take straight away is to reinstate that £8 billion cut to local authorities so they can at least provide services now for the social care system that we have.
I'm actually quite disappointed by the language that the honourable member uses, and I have huge respect for her in many areas that she works in, and she will appreciate that together with the department and actually with the local authorities and the care sector, we're working hard on how to bring forward the right package of reforms for the system. We have actually already taken some of the first steps on that road. For instance, in the Health and Social Care Bill, there are plans to introduce strengthened oversight for the social care system, which is an important step, but that is the beginning, not the end, of the social care reform road.
Mr. Campbell.
Thank you, Mr. Speaker. 685 days ago, the Prime Minister promised to fix the crisis in social care, to give every older person the dignity and security they deserve. Since then, more than 32,000 elderly people have died from COVID-19 in care homes. Millions of care workers and families have felt abandoned and pushed to breaking point. And 300 elderly people have been forced to sell their homes to pay for their care every single week. Does the Minister think that's giving people security, let alone dignity? And will she tell the country, after more than a decade in power, specifically, when will her government deliver?
Thank you, Mr. Speaker. What I will say after the enormously difficult year that social care has had through the pandemic is that indeed it has strengthened the already strong case for reform of social care. And I will say to her that I want us to have a better social care system, whether it's for our grands and granddads, our mums and dads, our brothers and sisters, our children and grandchildren, or indeed, as and when we need it, for ourselves. We have a once-in-a-generation opportunity to reform social care. Now is the time, now is the moment, and we will seize this opportunity, and we will be bringing forward proposals for the reform of social care later this year.
Anthony Bagden.
Mr. Speaker. Thank you very much indeed, Mr. Speaker. My ministerial colleagues and I are in regular contact with the Food Standards Agency on matters of common concern.
Thank you, Mr. Speaker. Next week, the Food Standards Agency will be producing its annual report and holding its annual general meeting. That report will likely recommend some significant changes regarding live bivalve molluscs, which has a huge impact on my own constituency and indeed the health of the nation for those who eat seafood. Can she commit that any changes recommended in the report next week will be brought forward in record time so that the changes may be implemented quickly and that we could secure the future of the seafood industry in the United Kingdom?
Thank you, Mr. Speaker. And a change to be talking about a different sort of muscle in this place during health questions. The Minister for DEFRA and I are well aware of the challenges currently facing the shellfish industry, and I thank the Honourable Member for Totnes for his dogged determination, but especially those businesses who rely on exports. We will continue to work closely with the FSA. I know they've been working hard to resolve these issues and make progress, and I have been advised there is potential for change. To ensure that classifications are awarded in a proportionate and pragmatic way while continuing to ensure high levels of public health protection, I can assure him I will continue to work closely with them and my colleagues in DEFRA.
My substantive question, Mr. Speaker. Thank you.
Thank you, Mr. Speaker. Well, I'm grateful to my honourable friend, not least for providing me with the only opportunity to answer a question on the order paper today. I am delighted to confirm St Anne's Hospital in Dorset is already part of our plan to build 48 hospitals by 2030, the biggest hospital building programme in a generation. The new build at St Anne's will provide child and adult mental health services to the people of Dorset, resulting in outdated infrastructure being replaced by facilities for both staff and patients that are at the cutting edge of modern technology, innovation and sustainability, driving excellence in this hugely important area of patient care.
Chris Lund.
Thank you, Mr. Speaker. Can I thank the Minister very much indeed, and particularly thank him for all his hard work in reopening the Yetman Hospital in Sherborne, which will happen in a couple of weeks' time for the A&E. Can I just say to the Minister, or ask him, on top of what he's offered already, and I very much appreciate it, would the Minister commit specifically to increase the inpatient provision for children and young people who have severe mental health difficulties in West Dorset, as we have a number of those difficult cases?
Thank you, Mr. Speaker. Well, I know my honourable friend takes close interest in these matters. As he will know, the number of places commissioned is a matter for NHS commissioners locally, but I can reassure my honourable friend that we can commit, and indeed my honourable friend, the Minister for Mental Health Services, is committed to expanding and transforming community mental health services across England, boosted by an additional £79 million this year, so that children and young people get timely access to the support and treatment they need without having to be admitted to hospital, alongside, of course, the investment I've referred to in inpatient mental health facilities at St Anne's.
Ian Levy.
Thank you, Mr. Speaker. Number 14.
Minister Doris.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. With permission, I'll take question 14, 15, 16 and 17 grouped together. We're transforming mental health services through the NHS long-term plan, investing an additional £2.3 billion a year by 23-24. Where national waiting time targets exist, the majority are being met. Targets for eating disorder services, sadly, are not being met, but additional resources have been allocated to increase capacity and to address waiting times. We're working on the consultation responses for the Mental Health Act White Paper, and will bring legislation forward when parliamentary time allows.
Ian Levy.
Thank you, Mr. Speaker. After a career working in mental health for almost 30 years prior to entering this House, I was delighted to be asked to become a board member for a local charity, Anxious Minds. They're based in Blyth in the town centre, and their aim is to improve mental health well-being for local people. Would my right honourable friend assure me and those who worry about the toll that this pandemic has had on the vulnerable that she will do everything she can to ensure that mental health is given the highest possible priority as restrictions begin to ease?
Minister.
Thank you. First, I would like to thank my honourable friend for his years of service of working in mental health. Mental health is one of this government's top priorities, and I can assure you that we are doing our utmost to ensure that mental health services are there for everyone who needs them. Through the NHS long-term plan, we're expanding and transforming mental health services in England and investing an additional £2.3 billion a year in mental health services by 2024. In addition, we have published our Mental Health Recovery Action Plan, backed by a one-off targeted investment of an additional £500 million to the £2.3 billion to ensure we have the right support in place this year. The plan aims to respond to the impact of the pandemic on the mental health of the public, specifically targeting groups which have been most impacted. We have set up a cross-government ministerial group to monitor progress against the actions listed in this plan, and the group will also identify areas for further action and collaboration.
Thank you, Mr. Speaker. And can I welcome the priority put on young people's mental health, more important now perhaps than ever. And can the Minister give an update on progress on implementing the proposals in the Children and Young People's Mental Health Green Paper, and particularly on mental health support teams in Hampshire and nationwide?
Minister.
We are making good progress on implementing the Green Paper proposals, and I'm pleased to say that we've established 11 mental health support teams in Hampshire. Nationwide, there are currently 180 mental health support teams covering around 15% of pupils in England. Over 200 more are in training or being commissioned, and we expect to have around 400 in place by 23-24, covering 35% of pupils. We recently announced £9.5 million to train thousands of senior mental health leads from school and college staff.
Thank you, Mr. Speaker. Last year, in my NHS Trust, 37% of children referred to mental health services were turned away. That's up from 28% the year before. That's 2,649 children not getting the treatment despite referrals from professionals. This will be exacerbated, of course, by the acute children mental health unit at Ticehurst being shut and no new hospital provision commissioned. It's not just Sussex Partnership which is failing, it is across the country. In 2019, 140,000 children were turned away from CAMS, and some experience exceptionally long waits. Is the Minister comfortable with these huge numbers of children being turned away from treatment? Does she think these waiting times are acceptable? And what message does she have to those children and families that don't receive the treatment that they desperately need?
Minister.
Mr. Speaker, the short answer to that question is no, and that is the reason why we have committed an additional £500 million to address the issues that he has, some of the issues that he has highlighted. But I must reiterate, the majority of our targets, where they've been set, are being met. Sadly, in eating disorders, I hold my hands up, we are not meeting the targets that we want to. But we are trialling, as I think you may be aware, the four-week waiting targets for children and young people, and the results of that review and that pilot will be available soon, and we can look at, and we continue to look at ways when we can increase access to services for children and young people, including, and children and young people have told me this themselves via organisations such as Barnardo's, that they want their mental health services delivered in a different way to them now. They don't want to go and sit in a village hall or a hospital or wherever they may be receiving their services from by community practitioners. They want their services, some of them delivered via their phones, their laptops or their computers. Obviously, one-to-one services have to be available where they're needed, but children and young people are demanding a change, and we're going through that change now.
Shadow Minister Dr. Olling.
Thank you very much, Mr. Speaker. The member for Brighton Kemp Town raises a very important point, and quite frankly I'm shocked that the Minister seems so relaxed about it. Across the country there are numerous children who have waited over 400 days for help with autism, 280 days for PTSD, 217 days for suicidal ideation, 195 days for treatments after an overdose. I could go on and on. Children shouldn't have to wait so long for treatment. It will have a scarring impact on their development. These simply are not acceptable. So I ask the Minister, will she apologise to these children? And can she explain where it went so wrong?
Minister.
Mr. Speaker, I do not believe that meeting almost all of our targets in NHS waiting times for mental health services, I do not believe that £2.3 billion a year of investment into our NHS, I do not believe that no NHS mental health service closing during the entire pandemic has been a failure. And of course, I am sorry for those children and young people who cannot get access to services as quickly as they want. That is exactly why we committed an additional £500 million and established a mental health recovery plan so that we can put community services in place to reach those who've been impacted most by the pandemic over the past 15 months. Mr. Speaker, we have a long-term plan which is in place with the investment that the NHS tell us that long-term plan needs to provide the very services that we want to provide. Mental health of children and young people is this government's priority, and we will continue to invest, and we are proving to continue to invest to make sure those children and young people access the services they need.
Number 17, Mr. Speaker. 18. Minister Churchill.
Thank you, Mr. Speaker. If it's number 17, it's going to be an interesting answer. General practice has remained open throughout the pandemic, offering face-to-face appointments as well as telephone and online consultations, whilst playing a leading role in our vaccination programme. We are enormously grateful to general practices, the GPs, their broader teams for everything they have done. But to ensure general practice can continue to provide all necessary and appropriate care during this very busy time, we have made an additional £270 million available until September.
I think the group as well, are they, Minister?
Indeed they are. I do apologise. They're grouped with 19 and 20.
Thank you. Robert.
Thank you, Mr. Speaker. If done right, we can use technology and data to improve healthcare services, improve patient outcomes and help save lives. So I welcome the government's proposals for a new GP data system. But it is vital that we do get this right with the appropriate protections in place. With that in mind, will the Minister update the House on these vital reforms?
Minister.
So I thank the honourable member for his question, and I couldn't agree with him more. Data saves lives. It's as simple as that. We've seen that in the pandemic, it's one of the lessons of the vaccine rollout. The GP data programme will strengthen this system and save lives. And patient data is, of course, owned by the patient. And we are absolutely determined to take people with us on this journey. We have therefore decided we will proceed with the important programme, but we will take some extra time as we have conversed with stakeholders over the past couple of days. The implementation date will now be on the 1st of September, and we will use this time to talk to patients, doctors, health charities and others to strengthen the plan, build a trusted research environment and ensure that data is accessed securely. This agenda is so important because we all know in here data saves lives.
David Johnson.
Thank you, Mr. Speaker. I've had quite a number of constituents contact me in recent weeks who are struggling to get a GP appointment. But we had a pre-COVID problem as well, which is that thousands and thousands of new houses have gone into the constituency without an increase in GP services. So will my honourable friend meet with me so we can discuss how to get my constituents the GP services they need and deserve?
Minister.
Thank you, Mr. Speaker, and I thank the honourable member for his question. It's right that local health commissioners pay careful regard to the impact of new housing and growing areas, which is to be welcomed. I understand that both practices in his area are still accepting patients, and the Oxfordshire CCG has been working closely with the practices in Wantage to make sure the impact of the housing growth going forward is being accommodated, and something I would expect all CCGs to be doing and councils to be doing. But of course, I'd be happy to meet him to discuss this further.
Paul Hubbard.
Thank you, Mr. Speaker. I've recently met with two cancer groups in my part in Sedgefield, the Solon and Connor Fawcett Family Cancer Trust and the Great Aycliffe Cancer Support Group. And while hearing about the wonderful work they've been doing over the last year, we also discussed how delayed GP appointments have affected early diagnosis of important medical issues like cancer. Early diagnosis is necessary to provide patients with the best chance of stopping the cancer spreading and of patient recovery. Furthermore, the later it's caught, the more complicated the cases become, and they take more time, more resources, and of course are horribly distressing. Could the Minister please tell me what's being done to ensure backlogs in these appointments are being addressed as urgently as possible?
Minister.
I thank the honourable gentleman for his question, and I would like to pay tribute to all cancer charities out there who've done sterling work during the pandemic. As I said, GP services are open. They are offering different forms of communication with patients. We are running a Help Us to Help You campaign so that people do come forward when they have symptoms. As he said, identifying cancers early save lives is part of the long-term plan. But I would like to assure him that general practitioners in March, my last data showed that in March 2021, we highest ever recorded number of GP referrals that we have ever had in cancer. They are working really, really hard, and patients need, if they are worried about any symptoms, to come forward.
Shadow Minister Alex.
Thank you, Mr. Speaker. For GPs and the NHS more broadly, using data effectively is an important way to restore our health services. However, the current plans to take this data from GPs, assemble it in one place and sell it to unknown commercial interests for purposes unknown has no legitimacy whatsoever. No public engagement, no explanation, simply snuck out under the cover of darkness. I'll get there, Minister, don't worry. An NHS data grab. Now, the news of the delay is welcome from the Honourable Lady. I'm glad that she's made that commitment. But will she commit to within that the 23rd of June opt-out date is also now moved to the 1st of September, and that there will be a full public consultation about whether the people want their data used for these purposes?
Minister.
So I thank the honourable gentleman for his question. I refer him to the answer I gave earlier to my honourable friend, and we will be considering everything in the round. As I have said, I have spoken to many of the stakeholders involved, and as we move forward, we will be making sure that we take all trusted individuals with us to build confidence in the system.
Right, let us now go to the substantive question to Minister Webb.
Thank you, Mr. Speaker. The organ donation opt-out system has increased the number of organs available for transplant and is saving hundreds of lives. Since the law changed last year, 296 people in England have donated their organs under the opt-out system. These donations account for 29% of the 1,021 donations that took place last year.
Yeah. Right, let's go to Dan Jarvis. Dan.
Thank you, Mr. Speaker, and I'm grateful to the Minister for that response. She will know that May the 20th marked 1 year since Max and Kira's law came into effect, a change that will give hope and save lives. But despite the tireless efforts of NHS staff, COVID has had a devastating impact on patients in need of life-saving operations. So can the Minister outline how she's going to get organ transplant services back to pre-pandemic levels, and what additional resources will be committed to support an increase in organ availability?
Minister.
Thank you, Mr. Speaker. Well, I would firstly like to thank the honourable member for the part he played in campaigning for this life-saving change to organ donations and bringing about the increase I mentioned earlier. Transplant services are now running at pre-COVID levels, and NHS Blood and Transplant is working with the wider healthcare system to enable as many transplants as possible. The new Organ Donation and Transplantation 2030 Meeting the Need strategy, launched last Tuesday, sets out the steps we're taking to further increase organ availability.
Substantive question to Minister Churchill.
Thank you very much indeed, Mr. Speaker. I've discussed these concerns with my honourable friend and both the co-chairs of the APPG on medical cannabis under prescription. He knows that I sympathise deeply with the parents of these children, the patients and their families, many of whom I've met. Dealing so courageously with conditions that are difficult to treat, my immediate priority was to resolve the supply of Bedrocan oil from the Netherlands. I have further meetings planned to make progress on other issues in this incredibly complex situation.
Let's go to Ronnie Cohen. Ronnie.
Thank you, Mr. Speaker. And I welcome today's letter from the Minister detailing the extension of the arrangement for the provision of Bedrocan, and I'm pleased that we're working towards the manufacturing of Bedrocan oils in the UK. I have two issues today. The patients still need to pay for their medicines. If the numbers are so small that it's a niche product, surely they can be provided free on the NHS. And secondly, I've been told that research is ongoing regarding the wider possibilities for medical cannabis. But despite being promised one a month ago, I'm still waiting on an update from the MHRA on clinical trials and licence application. Could that please be forthcoming?
Minister.
I thank the honourable gentleman. As he knows, I've met with Dr June Rain from the MRHA, and I've met subsequently with further specialist clinicians in this area to discuss progress with the research and evidence supporting prescribing on the NHS. Establishing of clinical trials is vital with the support of the National Institute for Health Research to make sure that we are making the right decisions on routine funding. From the 1st of April, we've introduced a national patient registry to record data and monitor patient outcomes in England, with a view to it being rolled out across Scotland and the other devolved administrations later this year, covering both licensed and unlicensed cannabis-based medicines on the NHS, with a view to include the private patients in due course. As he knows, I am very focused on making sure that we get the right solutions for families, but at the heart of this matter always has to lie the safety of what we prescribe.
24 withdrawn, so we go to Justin Matters.
Number 25, please, Mr. Speaker.
Minister Churchill.
Sorry. Gosh, we haven't got 24. I apologise. I'm up and down like goodness. Right. Okay. So, the government has produced a 4-step roadmap to ease restrictions across England. Before each step, an assessment is made against the 4 tests, including assessing the current risks posed by variants of concern. The move to Step 3 on the 17th of May was based on the assessment that the risks were not fundamentally changed by those variants of concern, and Step 4 is due no earlier than the 21st of June, and the variants of concern will again be considered in advance.
Shadow Minister Justin Matters.
Thank you, Mr. Speaker. On Sky News on Sunday, the Secretary of State was asked about figures that contradict his claim that India was not put on the red list at the same time as Bangladesh and Pakistan because positivity rates were 3 times higher in those countries. In response, he said he didn't recognise those figures. Well, he should have done, because there are his own figures from Test and Trace. Indeed, there are no published figures for the time the decision was made that support his claim, and given the allegation that the only reason there was a delay in putting India on the red list was to help secure a trade deal, and it is a delay that is now having serious consequences, will the Minister agree to publish all the data and advice this decision was based upon in the interest of transparency and accountability?
Minister.
The positivity rates were 3 times higher from Pakistan than they were from India when we made that decision. As the honourable gentleman knows, we keep these things under constant review, and we would be equally lambasted if decisions were made before we had the correct information. So acting when we have the right information on variants of concern is an important thing. We will keep following the data.
Peter Bowe.
Question 26, Mr. Speaker.
Sarah Stave.
Thank you very much, Mr. Speaker. In October, the Prime Minister confirmed a £3.7 billion funding allocation over the next 4 years to support the delivery of 40 new hospitals by 2030. And I am delighted that this includes Kettering General Hospital. We have since confirmed that there will be 48 new hospitals built by 2030, and 6 of these projects are underway.
Thank you, Mr. Speaker. And I'm absolutely delighted that one of the new Boris hospitals will be built on the site of Kettering General, starting with an A&E department and finishing the whole hospital by 2027. But, Mr. Speaker, unfortunately, there may well be a very substantial delay to this because of red tape and bureaucracy. Would the Secretary of State use his great skills, bang some heads together, get the pen pushers and accountants, might I say, to sort out the delay so we can get on with it? And would he be kind enough to meet with the 3 honourable members who represent North Hampshire to discuss the issue?
Mr. Speaker, nothing gives me greater pleasure than making stuff happen, and so I'd be very, very happy to meet with my honourable friend and with the nearby colleagues who represent the people who are served by Kettering General Hospital, to make sure we can get this project moving as soon as we can.
You can rebuild Chorley Hospital at the same time. Excellent. Right, 27 withdrawn. We have a substantive question to Minister.
Thank you, Mr. Speaker. Work on the scope and organisation design of the OHP is ongoing. We will present more detail on our plans for the Office of Health Promotion in due course. Public Health England's Better Health, Every Mind Matters social marketing campaign aims to inform and equip the public to look after their mental health. Its NHS-endorsed website offers guidance on the actions people can take to improve their mental well-being, including practising mindfulness and reflection.
Let's go to Margaret Farry. Margaret.
Thank you, Mr. Speaker. Research shows that mindfulness training can contribute to improvements in obesity, eating behaviours, addiction and mental health and wellbeing. Will the Minister ensure that the Office for Health Promotion looks at the evidence of how mindfulness can help in how we all manage our health?
Minister.
There is emerging evidence which is based around mental health benefits of mindfulness, which can take the form of mediation or wider approaches that incorporate a mindful approach. And as the Honourable Lady may be aware, it's been a particular issue of mine that we separate out mental illness and well-being and mindfulness, so that we focus on mental illness, which needs the intense clinical intervention within our NHS services, but that we look at mindfulness and well-being, and that's why I mention Every Mind Matters, because the facilities are there.
Robertson.
Question number 29, Mr. Speaker.
Minister.
The pandemic has proven to the public how vital our highly skilled pharmacy teams are in supporting their communities. And pharmacies have massive potential to build on new services that they are already delivering. We will continue to look at how we can use them further.
Thank the Minister for that answer. Can we also make sure the public are aware of everything pharmacists can do so that they can use those to take the pressure off GPs?
Minister.
Indeed we can. I would be honoured to work with him to do that, so people think pharmacy first. They are delivering flow tests, lateral flow devices into our communities. 500 of them have stood up to be vaccination sites. We now can refer from NHS 111 and GPs into community pharmacies for prescribed medicine supply and for minor illnesses. We need our pharmacies to show their skill base. They are a highly skilled group that we should be all asking to do more and celebrating.
Dr. Jamie Wallace.
Call question 1, Mr. Speaker.
Secretary of State.
Mr. Speaker, I can tell the House that today, working with local authorities, we are providing a strengthened package of support based on what's working in Bolton to help Greater Manchester and Lancashire tackle the rise in the Delta variant that we're seeing there. This includes rapid response teams, putting in extra testing, military support and supervised in-school testing. I want to encourage everyone in Manchester and Lancashire to get the tests on offer. We know that this approach can work. We've seen it work in South London and in Bolton in stopping a rise in the number of cases. This is the next stage of tackling the pandemic in Manchester and in Lancashire. And of course, it's vital that people in these areas, as everywhere else, come forward and get the jab as soon as they're eligible, because that is our way out of this pandemic together.
Dr. Jamie Wallace.
Thank you, Mr. Speaker. At present, all primary care providers in Wales remain on amber alert, and this means that many of my constituents in Bridgend are unable to access necessary services unless it's an emergency. Could my right honourable friend explain how this compares to his department's strategy to provide catch-up services as we come out of lockdown?
Well, it is very important across the country that the UK is open, that the NHS is open, that people can come forward and get treatment if they need it. As he knows, I work closely with the delivery of the NHS in Wales. The NHS is, of course, the responsibility of the devolved administration. But I'm very happy to take up his concern with the new Welsh Minister for Health to see what we can do.
The Secretary, Jonathan Ashford.
We've seen reports today of how exhausted NHS staff
are. Now, the DEFRA Secretary on the media this morning said he's not sure what more the government can do to support NHS staff. Well, obviously the government can give them a pay rise, but can he also commit today to extending free hospital car parking for NHS staff beyond the pandemic?
Secretary.
Well, of course, we have made hospital car parking free for staff during the pandemic. That's one of the many, many things that we've put in place to support staff. Staff wellbeing support and mental health support has also been incredibly important. Learning, for instance, from the support we give to others in public service who go through traumatic episodes. So he's quite right that there's a wide array of things that we need to do to support NHS staff on the front line.
Shadow Secretary Ashworth.
To extend the relief of hospital car parking charges beyond the pandemic. Now, he knows that waiting lists are at 5 million and that 432,000 are waiting beyond 12 months. The priority has to be, once we're through this pandemic, to bring these waiting lists down. But he's about to embark on a reorganisation of the NHS with his integrated care legislation. And these local boards permit the private sector to have a seat on them. Virgin Care has just been given a seat on the ICS in Bath and North Somerset. He once promised no privatisation on his watch. So will he instruct that ICS to remove Virgin Care from its board?
Well, he's absolutely right that integrating the health service and integration between the health service and services provided by local authorities like social care is absolutely critical. And I know that he supports those proposals that have come from the NHS. And of course, the thing about delivering services in the NHS, Mr. Speaker, is what matters to patients is that they get high quality services, for instance, to deal with the backlog. And what matters is getting those services as fast as we possibly can. People care much less about who provides the service than they care that the service gets delivered. And that's the approach that I take too.
Select Committee.
Thank you, Mr. Speaker. Today, the Select Committee published its report on NHS and care staff workforce burnout, which chronicles the emotional exhaustion, the chronic fatigue felt by many frontline staff in the last year. Now, much support has been put in place. The 50,000 nurse target is welcome. The extra doctors and nurses hired in the pandemic, extremely welcome. But still, we have shortages in nearly every specialty, leading to a sense of despair. So will my right honourable friend consider the recommendation we make today that Health Education England should be given the statutory power to make independent workforce projections, rather as the OBR does for budget forecasts, so that we can at least look doctors and nurses in the eye and say we are training enough of them for the future?
Well, I'm very happy to work with the Select Committee on the forthcoming Health and Care Bill, which the Select Committee has had a huge amount of input into already, and during its passage I'm sure that we'll be working together on making sure this piece of legislation, which has cross-party support, can come through this House in the best possible state. I'm very happy to look at the specific proposal, but what I would say is that we have been recruiting record numbers of doctors and nurses to try to make sure that the NHS is always there for you and for your family.
Kirsten Oswald.
Thank you, Mr. Speaker. The British Medical Association have warned that the freezing of the lifetime and annual pensions tax allowance until April 2026 could significantly impact the retention and overtime of health and care staff, with 72% of doctors they surveyed saying it would make them more likely to retire early. What consideration has been given to the BMA's proposal of offering a tax unregistered scheme similar to the judiciary for those in the NHS?
Well, we made very significant progress on this in the budget immediately following the general election, as she'll know, and that has removed this problem from the vast majority of doctors who serve in the NHS. I'm very glad that we were able to make that progress. I'm always happy to look at suggestions from the unions and others, but I'm glad to say we've made a good deal of progress on this one.
Marquis.
Thank you, Mr. Speaker. Despite the recent rise in infection rates, COVID-related deaths and hospital admissions remain low across my constituency. Surge vaccinations and testing is being effectively rolled out in high-risk areas, and pop-up vaccination centres like the Derby and Joan Club in Clayton West are doing a fantastic job.
Given this, could my right honourable friend assure the people of Dewsbury, Murfield, Kirkburton and Denby Dale that there will be no need to introduce local restrictions in the future?
Who's up?
Thank you, Mr. Speaker, and I join my honourable friend in congratulating the whole team for the incredible work that they did under pretty difficult and urgent circumstances. I would reassure him, as the Prime Minister, as the Secretary of State has said from his dispatch box, that we want the whole country to come out of this lockdown together.
Let's go to Virendra Sharma.
Thank you, Mr. Speaker. My constituents continue to be concerned that COVID-19 is being used as an excuse to permanently remove services from Ealing Hospital. Accepting temporary suspensions is fine for COVID-19. But will the Secretary of State confirm that this public health crisis will not be used as an excuse to scrap services without following proper consultations and undertaking rigorous impact assessments?
Secretary of State.
Yes.
Robbie Moore.
Thank you, Mr. Speaker. The Airedale Hospital celebrates its 51st birthday this year, despite having a life expectancy of 30 years when it was originally built. And 83% of the hospital is built from aerated concrete, which is known for its structural deficiencies. My right honourable friend be well aware of my campaign to get a rebuild of the Airedale Hospital so we can mitigate this structural risk and deficiencies. Will he come to the Airedale Hospital to meet with me and Brendan Brown, the Chief Executive, so we can discuss these plans in more detail?
I think the answer is yes.
Well, I can't. Mr. Speaker, not only has my honourable friend made a compelling case for me to visit, but you just told me to visit, so I've got my marching orders. I look forward to my now forthcoming visit to Airedale Hospital. I haven't actually been yet, and so I'm very, very keen to come. The Minister of State responsible for the hospital building programme, I know, has been heavily involved in this. I've been looking at the paperwork. As he knows, on top of the 40 hospitals we've announced, 6 which are currently already being built, we have 8 further slots to come, and Airedale Hospital is very much on my radar when it comes to those slots. We will run an open competition, we'll make sure it's fair, but I'll certainly come and visit.
Let's go to Stella Creasy. Stella.
Thank you, Mr. Speaker. Mr. Speaker, this week the Prime Minister has praised the major benefits of the PFI companies that are part of the LIFT initiative running GP services. That's why I'm sure the Secretary of State will be disappointed to learn that here in Walthamstow, Community Health Partnerships, a PFI LIFT company that we estimate has made several millions of pounds of profit from this deal on top of its service charges, and which the Secretary of State is ultimately in charge of, has just handed our local toy library a business rates bill for £30,000 for during the pandemic. I hate to add to the Secretary of State's busy diary, but will he meet with me to discuss what we can do to make sure that such companies stop making major profits from our NHS services and ensure that benefits like a toy library are not lost due to their antics?
Secretary of State.
Yes, I'll ensure that the Minister of State takes a meeting with the Honourable Lady.
Nicky.
Thank you, Mr. Speaker. I'm sure my right honourable friend saw Fergus Walsh's report on BBC News last week on the groundbreaking treatment for spinal muscular atrophy, SMA, and the importance of the UK's newborn screening programme. Surprisingly, the UK currently is only screens for 9 rare diseases in the heel prick test, compared to other European countries like Iceland and Italy, who test for 47 and 43 diseases respectively. The sooner the diagnosis for a child of a rare disease, the better, which can change their lives and their life chances. With this in mind, does he agree with me that the UK should really now be considering an expansion of the UK newborn screening programme? And will he agree to meet me or ask a Minister of State to meet with me and campaigners on the issue?
State.
Yes, I absolutely. I 100% agree with the Honourable Lady. And we do have the funding that to expand this programme, and she'll have seen in the National Genomics Strategy that we set out that newborn screening is specifically highlighted. It's a personal mission of mine to make this happen, and I'd be very happy to meet with her and with Baroness Blackwood, who's the chair of Genomics England, who has been driving this project forward.
Abeno Pongasari.
Thank you, Mr. Speaker. An early diagnosis gives the best chance of survival, but a GP in my constituency has raised serious concerns about delays in accessing urgent blood tests, which are critical for diagnosing cancer. Will the Secretary of State ensure that local issues such as this do not worsen the already significant cancer backlog and put more people's lives at risk?
Minister?
Yes, she raises a very important issue, and if she will write to me with the full details, then we'll get right on it.
Let's go to Caroline Ansell. Caroline.
Thank you, Mr. Speaker. I am delighted to report back to my right honourable friend that the University of Brighton, which has a campus in Eastbourne, has experienced a significant rise in the number of applications to study for careers in health professions. A shortage of training placements is the only real break on the numbers of would-be students. I understand, talking to the university, that in the UK, students must complete over 2,000 hours in placement, and this is in contrast to Australia and New Zealand's 1,000 hours. Is this seemingly high requirement under review with Health Education England, so we don't miss an opportunity to capture this new interest, build the NHS workforce of the future, open opportunities to all those who have the talent to succeed, and of course further secure my hometown as a destination for such learning.
Minister.
Thank you very much. My honourable friend makes a really important point. I should say to her that nurse education standards are set by the Nursing and Midwifery Council, the NMC. Their current standards are based on EU law, but that no longer applies to the UK. The NMC has launched a survey on whether these standards should change. I would also say to her that acceptances onto pre-registration nursing programmes at English universities for 2020-21 increased by over 5,000 since the previous year.
John Morrow.
Thank you, Mr. Speaker. Many constituents have contacted me deeply concerned by government proposals to grab, store and share GP health data. So can the Secretary of State tell me this? If I opt out of this data grab, will my health data be available to a hospital outside my home area should I have an accident, for example? And if I don't opt out of it, how can I control how my data is shared, whether individually or in aggregate? Because I don't want to have to choose between privacy and my health.
She's quite right, and if she was in earlier, she would have heard that the Minister set out that we're going to delay the deadline on this programme, including the opt-out, which is currently scheduled to end on the 23rd of June, and we will, and that's already been welcomed whilst we've been in here by the Royal College and the BMA, and then we'll work through these issues, because I think everybody agrees that data saves lives. We have to make progress in this area. It's very, very important. We have to do it in a way that brings people with us and resolves exactly the sorts of issues that she raises.
Thank you, Mr. Speaker. Although COVID cases remain above the national average across Kirklees, thankfully, hospitalisations and deaths remain low, and locally, my constituents are getting vaccinated and they're getting tested. So can the Health Secretary please confirm he will not reintroduce local restrictions?
Well, I'm really glad to say that in Bolton and other parts of the country where we've sent in the big package of support, including surge testing, as we have in Kirklees, we've then seen a capping out of the increase in rates without a local lockdown, thanks to the enthusiasm of people locally and, of course, the vaccination programme. That is our goal. Our goal is that the country, that England moves together. Of course, and that's what we're putting these programmes in place to do, and we are seeing them work.
Thomas.
Northwick Park Hospital, Mr. Speaker, which serves my constituents, was the first to be hard hit by COVID last year. And at the height of the second wave in January, its remarkable staff were looking after some 600 patients. It needs investment in intensive care and recovery services. So when ministers receive the business case, can I ask them to look particularly sympathetically at that case?
So State.
Yes.
Greg Smith.
Mr. Speaker, Macmillan estimate that the current backlog of people awaiting a first cancer treatment across England stands at 1,000 people. So what plans can my right honourable friend outline to bolster cancer services so that those people get the treatment they need?
Recovering the backlog that's been caused by the pandemic is a huge task for the NHS. It was raised by the right honourable gentleman on the front bench opposite, quite rightly. The backlog has been increased, unfortunately, because of the consequences of the pandemic. We've put in extra money, extra £1 billion this year. We are seeing cancer services running at 100% of their pre-pandemic levels, in some cases above 100%, in order to get through the backlog. The most important thing for the public watching this and for his constituents is to make sure that the message gets out loud and clear that the NHS is open, and if you have a problem, please come forward.
Jonathan Edwards. Diolch, Mr Speaker. What recent discussions has he had with the Home Office regarding the successful clinical trials of the use of psilocybin in helping deal with depression? It's a natural chemical found in fungi.
It isn't anything that has yet come across my desk, but I'll make sure that the relevant minister writes to him with as much detail as we know.
Let's go to Paul Maynard. Paul.
Thank you, Mr. Speaker. Community defibrillators are vital potential lifesavers. Many community groups fund investment in them. It's concerning to hear members of the public denied access to such defibrillators when they are on private land. What can ministers do to ensure access is presumed rather than subject to permission?
What my right honourable friend says is absolutely right. That, of course, if you put a defibrillator on private land, access to it should naturally be open to anybody who needs it. I will look into the exact legal status, but let's set aside the legal status for a minute. If you are a landowner and there's a defibrillator there that could save somebody's life, of course you should allow access to it for anybody who needs it.
Jessica Morden.
Thank you, Mr. Speaker. As current government investment in motor neuron research is not the targeted funding that's needed, will the Minister meet with charities, researchers and patients to examine this discrepancy and to commit to an additional funding of £10 million a year for 5 years for a virtual motor neuron disease research institute with a specific focus on helping us get a world free of MND?
Minister.
I will look into her specific request, but what I can say to her is that the government is actively supporting research into motor neuron disease. For instance, in April, I jointly hosted a roundtable event on boosting MND research with the NIHR Sheffield Biomedical Research Centre, which brought together researchers and others, and we're absolutely committed to this area of work.
Final question, Mark Harper.
Mr. Speaker, I'm very grateful that you could fit me in at the end. The Secretary of State yesterday at the statement didn't have available to hand the information as to the efficacy of the COVID vaccines in reducing serious disease and hospitalisation, and he made a commitment, rightly, to set them out today at Health Questions at the dispatch box, and I'm delighted in this question to give him the opportunity to do so.
Thank you very much, Mr. Speaker. Firstly, I can set out that a single dose of the Pfizer or AstraZeneca jab offers protection of 75 to 85% against hospitalisation, while data on 2 doses, currently only available for Pfizer, indicates 90 to 95% effectiveness against hospitalisation and 95 to 99% effectiveness at preventing death. However, the question that my right honourable friend asked was specific also to the Delta variant. And I said that I didn't have the figure in my head for the reduction in hospitalisations. And I don't know whether I should be glad, but I can report to him that the reason for that is that there is not yet a conclusive figure. I spoke to Dr. Mary Ramsey, who runs this research at Public Health England, this morning, and she told me that this figure is currently being worked on and this analysis being done scientifically and should be available in the forthcoming couple of weeks. It's obviously an absolutely critical figure, and I'll report it to the House as soon as we have it.
I now suspend the House for 3 minutes to enable the necessary arrangements to be made for the next business. Order.